Welcome, everybody, and thank you so much for joining us today for a discussion about school social work amidst COVID-19. I'm just going to give everyone a chance to log in and get settled. I know that I can see that everybody is still joining. A couple of housekeeping rules. All attendees are automatically muted, so don't worry if you have any background noise going on. We understand you might have kids, the gambit. We can't hear you, you can only hear us. At some points, we may ask for audience to raise their hands and participate, and at that point, I will call you up, and then you will be able to unmute yourself to participate. If you have any questions, please refer them to the Q&A box, but if you have any comments, feel free to put that in the chat. We just want to try and keep some of the questions to the Q&A box so that we can navigate that a little bit better. We do have nearly 1,000 people registered, so we may not be able to get to all of the questions, but we sure will try to keep the conversation as engaging and answer as many as possible. I think we have mostly everyone with us right now, so I will turn that over to Jen and Alexis.
Good afternoon, everyone. Welcome. I see a couple people still joining. My name is Jennifer Thompson, and I am the Executive Director of NASW New Jersey, and I am coming to you from my home, as most of you are at your homes. Just as a little bit of background, I am also mother to a 7-year-old who you will see undoubtedly in the background. So if you also have children at home and you're on screen, you're in good company here, and there you go. You're in good company, and if they're on the line, we welcome them. These are a sign of the times these days, and we're all living in close quarters. I'm glad that you all can join us today. I think this is an important conversation. We really wanted to create a space for school social workers to come together, talk about some of the challenges that you're experiencing. How are you connecting with your little people? How are you doing the work that you do as it's so drastically changed in the last 3 weeks? And this is really a space to just have a dialogue and to give us feedback on what kind of things that you're looking for, to bounce ideas off one another, and to share. So I am going to actually bring on Alexis. She is a school social worker and out of the field at the moment, but I'd like for her to just share a little bit about some of the feedback she's been hearing from her colleagues, and we'll get the conversation started off that way, and then we will bring in questions and answers and conversation from everyone who else is on the line. Welcome, Alexis. Thank you for joining us.
Thanks very much, Jen. So yeah, I'm a high school social worker in Jersey City. I'm currently on maternity leave myself. I just gave birth to my daughter, my first child, 3 months ago. So I'm not currently in the trenches, as they say, but I've been talking a lot to my colleague at school and certainly some friends and other social workers. And I think, school social workers are very unique because the job looks different in every district, in every position. So it's even more complicated, I think, for us because our responsibilities vary so much. And also, as Jen was saying, as far as telehealth goes, there's a lot up in the air right now. I had a brief conversation with my principal actually yesterday, and they were waiting to hear exactly what that means or what that looked like for our school. So I certainly know that, sessions providing counseling and that support to students is on a lot of school social workers' minds. The child study team component has been very stressful. I know for my school, myself and the other school social worker, we're important parts of the child study team. So she's trying to figure out how to have those meetings in the most productive way possible while also remaining compliant with the law and making sure that students continue to receive those services. So I know that there's probably a lot of good feedback, and I'm very curious and excited to hear about what else is out there and what else we should talk about and really hopefully shed some light on and get some direction on.
Yeah, thank you. There's certainly no shortage of questions, and I'm going to just encourage all of the attendees to start typing, your questions and into the Q&A, because we really want this to be an interactive conversation. We don't want it to be just one way. We want you to share with us what your concerns are and us to bounce ideas off of one another. One of the first sort of questions that have come up, and I'm curious to know if you have any thoughts on it, and then we can open it up. Also, perhaps Annie, if there are people who, if you have a response to some of these questions, if you could raise your hand, and Annie will bring you online to respond live. There is a question from Jacqueline. Curious how everyone is handling the new teletherapy laws, specifically for counseling mandates for IEP students, And also if you're offering counseling to students who do not have IEPs, what platforms are people using? And I don't know, Alexis, have you heard anything from your colleagues and peers? And then if you have experience in this, if you could raise your hand.
So I myself don't have any experience or really any hard answers. I would also just like to add to that as far as students that might not have counseling per their IEP that mandated, but I know that from personal experience, we had tons of students that needed those services, even that didn't get them directly. So what about the students that may need them that we might either not know about, or maybe legally they're not entitled to them? How do we continue to support them as well?
Yeah. Is there anybody who has their hand raised that wanted to respond to this, Annie?
Yeah, I saw a few people raise their hands once you had mentioned that. I see there's Wendy O'Donnell. Wendy, I'm gonna bring you on if you'd like to talk. You should be able to unmute yourself, Wendy.
Hi, I work in Vineland, New Jersey. We've been doing Google Meets and Zooms. We've been having INRS meetings, child study team meetings, and individual counseling also. I have reached out to kids that haven't had success getting on to the computer system. We have a list of no contact, so I've been reaching out to them also. And then we incorporated a guidance referral form that we are using, that the teachers are doing a check-in each day with the students, specifically for social emotional issues. And if they have any concerns, they fill out the form and email it to us, and then we contact the student directly.
Great. Thank you so much, Wendy, for sharing. Did anyone else want to respond to that, or hands up in that response, Annie?
Oh, yep. We have Denise. Denise, I'm going to bring you up. You should be able to unmute yourself. Denise, are you there? All right, we'll come back to Denise. Martha, I see Martha, you have your hand raised. I'm gonna bring you on. If you want.
Martha Rand, very excited to hear from you.
Oh, nice to speak to you too. So our district has also allowed us to work with the Google platform. So we're using Google Meets to do contacting. And, so as I hear from administrators or guidance counselors or teachers, I get the okay from the principal to contact the student if somebody thinks that it is necessary to check in on them. For the regular counseling, like, we're still in the process of trying to make that work as well as possible. The IEP required counseling, that's still in process. And for the students, a couple of them are reaching out for some support. And so I'm trying to work with them, and I just keep on going up the line to make sure that I have permission to work with them throughout the course of the week. So that's basically it for what we're doing. I've also been doing, because we have Google Classroom and I have a classroom that's part of social emotional learning, I'm writing a post every day with some ideas for students to work on relaxation exercises, some of which I'm writing about in there, and some of which I'm linking to other sites online so that they can tune into that. And there are a lot of sites that are available. So each day of the week, I have it kind of divided up into something, working with imagery, working with relaxation, working with time management, working with the arts, and working with physical activity. So that's what I've been doing so far.
Thank you, Martha. Just as part of this conversation, I do see I'm sort of scrolling through the webinar chat on the side, and there are a lot of questions about compliant software. And one of the things I wanted to just make sure that we touched upon in this conversation is the Hipaa guidelines. And we know that there has been a lot of conversation about Hipaa guidelines being relaxed, and yes, not necessary these days. There have been ease and regulations, but I want to make sure that everybody understands sort of the implications of what that could look like. And just because you can doesn't mean you should. And I feel like I keep saying that over and over and over again, particularly right now regarding telehealth and delivering services. There are so many HIPAA compliant softwares that are free or low cost right now. And we want to make sure that, you know, we are following our code of ethics, and we are still making sure that we are protected and doing the right thing by our students and our families and our clients. And I think even though you can, doesn't mean it might be the best solution for you. There are a lot of questions out there right now via Zoom and whether it's considered safe these days. The truth is, I think we're going to continue to see more and more hackers and malware and bad things happening because they're just bad people who want to take advantage of the situation. But there are a number of really great platforms. People were sharing them in the sidebar in the chat, DoxyMe, Ring Central, a couple of others that you can get, and completing a BAA. We've got some resources on our website if people are not sure what to be using. I invite you to go to nasw.org, and it's under the Resources Center for Social Workers. You can link to it right from our homepage. But there's a lot of examples of HIPAA compliant software out there, some of which is free, and I certainly encourage you to look at that before going down the non-compliant path. And also checking in with your, you know, if you have liability insurance and your district's insurance and things of that nature, because there are a number of other considerations to take it, you know, when you're thinking about using some of these platforms. Oh goodness, lots of questions. Let's see. There was one just a second ago I wanted to get to, a little outside of the conversation of technology, but Robin says we have 2 students who from our high school who have had family members who have passed away of COVID-19. Are there ways as social workers that we can come together to help our students with these losses? Alexis, any thoughts, or if you'd like to respond to that, if you could raise your hand as well. Anyone who'd like to weigh in on that? Probably a question on everyone's mind. Annie, is there anyone with a raised hand?
Yeah, I can bring somebody up. We have 2 people who have their hands raised. We have Demetria. I can bring Demetria on.
Thank you.
All right, you should be able to unmute yourself, Demetria.
Hi, thank you for taking my question. I think that when people have death in the midst of all these other terrifying uncertainties and we can't see them, and if they don't have technology, maybe we can send them some type of a handwritten note that would express our feelings of condolences. That might be the only option, and even that has risks because the mail has to be sprayed and carefully disinfected. But that would be my only suggestion for that at this point.
Thank you. I think that's a really great suggestion. Other people who might want to weigh in on that, if you could raise your hand, that would be great.
I just wanted to add, while we're waiting for someone else that might want to answer, I think, as Demetria said, it's a very kind of unsure, turbulent time for a lot of families, and to lose someone just kind of adds to the trauma and the uncertainty of this time. So really, I think the connection with school social workers or school staff, really, that maybe the students have relationships with, they can be a comfort to them and kind of offer the support and reassure them in ways that maybe that they might not be getting at home, or maybe just outside of the home, or maybe outside of the people that they have direct access to. You know, school might be providing them a support that they are obviously not receiving right now because they're not in the building with us. So just making it clear that you're there and available to them in a way they might not know about.
Thank you for that. Having people just available and making sure that we know that we can reach out is really important right now. And I can say from my own experience, really appreciated that our school social workers have made themselves so available to our children to talk through some of the issues, but even as parents as well. And just knowing people are there is helpful, even to the social workers in the room. Was there anyone else you want to up, Annie?
Yeah, Nina, I see Nina, you have your hand raised. I'll bring you on if you want to unmute yourself.
Hi, yeah, I'm a school social worker in Newark, New Jersey, but imagine, I put it in the chat. We work really closely with them to offer grief and loss support in our school anyways, but they're also offering now virtual support groups. So they typically have nights of support every other week for families, but now they've opened it up. They also have a separate text support and group support line for first responders, healthcare professionals, EMS, fire department, police department, social workers who might need it because we're caring for people who are caring for people. So they're really opening up, and they specialize in grief and loss support.
Thank you, Nina. Was there anyone else on that topic, or okay to move on, Annie?
I see there's also Kathleen. Kathleen also had her hand raised, so I'll just bring on Kathleen. You should be able to unmute yourself.
Okay, can you hear me now?
Yes.
Okay, so each county in the state of New Jersey also has the Traumatic Loss Coalition, and I actually am part of the team down in Gloucester County, and today we had a meeting with our coordinator, and they are all set up also to reach out and help the schools basically through the telecounseling, but they do have their everything set up in order to reach out to families who have had losses through that as well.
Great, that's a fantastic resource. If you wouldn't mind maybe putting that also in the chat for everyone to take a look at, that would be really helpful. I'm just going to move on to a couple of other questions because we've got 20 some queued up, and I want to make sure that we're moving through them just as quickly as we can. A question about parents signing disclosures. I'm not sure the name, but are you having parents sign disclosures when during virtual counseling, given that there may be unintended listeners and limits on confidentiality? Alexis, I see you nodding your head. Do you have thoughts on that? And if you have a response to it also, or how your district might be handling it, if you could raise your hand, we'll bring you on the line as well.
I just want to add, unfortunately, I don't have a firm answer. It's a great question. And how does one ensure that confidentiality is being met and that we're really protecting the privacy of students while they're at home or their families? I just think that's a really important question.
Is there anyone who'd like to share how their district is handling it, or tools or resources that you found helpful? Raise your hand. That'd be great. We'll have Annie unmute your line.
I see Beth has her hand raised. I'm gonna bring you on. Oh, it looks like Beth got her. Oh, Beth can see you.
Okay.
Hi, Beth.
Hi, how are you? I'm a school social worker in Northwest New Jersey, North Warren Regional School District. We are using the Zoom platform, and for my IEP counseling, my district is requiring an email consent, and that the parent needs to be available. So I really am not able to guarantee confidentiality the way I would have it in the school setting in my office. It's made me a little uncomfortable, but I'm kind of stuck with the confines of my school district at the moment. I have found that when I'm calling students or calling parents on telephone, because there's so many tech issues and logging into classroom issues, that the students are just grabbing the phone and I end up talking with them. So it's a little bit of the Wild West out here, but we're really just trying to be supportive. You know, the kids want contact, they want support, they want to see us on the video if it's possible. I've not really come into conflict yet, other than I know that there's things probably going on with my kids that they're not comfortable talking about with their parents around, and I'm not really sure how to work around that.
Yeah, that's certainly got to be difficult. Like lots of issues coming up, even in households that traditionally haven't engaged with the school social workers, and I can't imagine how you even start to identify those. And then create virtual responses to them. Is there anyone else who wanted to jump in and add to this part of the conversation?
Yeah, we have a bunch of people with their hand raised. Thank you so much, Beth. I'm gonna take you. All right. So I see Erica. Erica, you have your hand raised. I'm gonna bring you up. You should be able to unmute yourself now.
Okay, can you guys hear me?
Yes.
All right. For right now, we've just been giving verbal consent to our families. I'm actually a behavioral health consultant, so it's maybe a little bit different for the school. But for now, just because we can't meet face-to-face, and unfortunately some of those consents weren't turned back in before schools closed, we're really just doing verbal for now. So I don't know if anyone else is doing that. So that's it. I don't. Yeah.
Yeah, thank you, Erica. I appreciate that. Oh, Annie?
Yeah, I'm going to bring on Socorro. Am I pronouncing that correctly? I'm going to bring you on. You should be able to unmute yourself now. Hi, I see you're unmuted. We still can't hear you if you're talking. All right, I'm gonna circle back. Jacqueline, if you wanna come on, you can unmute yourself now.
Can you guys hear me?
Yes.
Okay, so I was just going to say very similar to what Beth is doing. My school is also providing an email consent where we just have the parent reply back giving that consent. A few things that I thought were important to mention that we have in our consent form is that the parent understands that there's risks and consequences associated with the telehealth, which could include a disruption of the technology. Also that there's no recording of the sessions by either party. I think that was a big one too, that we wanted to, excuse me, really make sure that we were protecting ourselves that way. And then at the end of our consent, we also just had the parent provide emergency contact information for themselves in case we needed to get in touch with them. And we also stated that we start every session asking the child what their location is in the event of an emergency or any suicidal ideation. We want to make sure that we can get to that child right away.
Great, thank you. I think those are really important things to make sure that you're considering when you are starting to engage the students, particularly with the physical address and knowing where to find people in case of emergency services. We've talked a lot about that with our private practitioners as well. So I appreciate you bringing that point up. Was there anyone else, Annie, who wanted to respond, or can we move on to one of the other multiple questions?
Yeah, I'll bring just one other person on. Dawn, I see you have your hand raised. You should be able to unmute yourself now.
Hey, Dawn, we still see you're muted.
All right. Okay. As an old supervisor, I just want to reaffirm with you that as you do these new consents and particularly if you are, as one person mentioned, taking it verbally, do the due documentation, please. I know you all know this, but I gotta tell you to do it. But just make sure your documentation is really very, very clear, and taking the address, that kind of thing is also important. Just adhere to it, because you're going to need all of that documentation and the tracking. So please do yourself a favor and do that. Okay, that's it from the supervisor.
Thank you, Dawn. It's a valuable perspective. I'm glad you're able to join us. A couple of other questions. I'm going to just keep plowing through them because I know that there's a lot of things to talk about. Tara wants to know if anyone is doing anything with initial referrals in process, and initial eligibility since school closure. I don't know if you have heard anything, Alexis, or if there's anyone else who has thoughts on how you're handling these issues in this process. We'd love to have you raise your hand and share with your colleagues.
I haven't heard anything in direct response to the initial process or referrals or even reevaluations. I know that my school, they're still holding the child study team meetings. They're using Zoom. But I would be curious to know how other districts would be handling those including an evaluation in general. How might that work if you're not in the same room with the student? For an LDTC or a school psychologist, or even for a social worker?
Oh, those are great questions. Is there anyone who has any thoughts on that, would like to respond and has their hand raised?
Yes, we have a few people with their hand raised.
Great.
Longete, I'm going to bring you on. You should be able to unmute yourself. I see you are unmuted.
I'm unmuted. Okay. I'm from Monmouth County, Neptune City School District, and we had our county meeting today. And the annuals we can still hold if we use like a Google Meets or a Zoom. Re-evals, there are no re-evals because those are in person. So that'll pick up when we come back. If we're doing an initial, and it's 90 days or 60 days for re-evals, the day starts back. So if we ended, let's say, March 13th, and that was day 10, when we come back, let's say in June, that'll be day 11. So that's where we are. We can hold annuals via, whether it's telephone or video conference, but re-evals, the preschool right now, early intervention is not going out to the home. So no referrals are coming in. So those will pick up when we come back from school. And right now, the timelines, this is how it's going to be. That's what we were told from our county meeting today.
Great, thank you for that. And I can see somebody also shared on the side conversation that New Jersey Department of Education just put out a statement that there can't be any evaluations. So we'll take a look and start to investigate that and see if there's information that we can share with the group after this. Who else had their hand raised?
I see Elizabeth Rubarski. Elizabeth, I'm going to bring you on. You can unmute yourself.
Hi, how are you?
Good, how are you?
I'm good. So I'm in Edison, and right now we're still holding initial eligibilities and reevaluations. At first we were told not to sign for consent, but now we are, and just sending them a letter that once we come back to school, then all the evaluations will be completed.
Great, thank you, Elizabeth. Next. And then as we get the next person up, there is a question in the sidebar. Is this webinar for New Jersey school-based social workers only? No, we have social workers joining us from all over the country. Well, I think the bulk of them are probably here in New Jersey because that's where we're based. If you have questions, Evelyn, certainly feel free to chat them in, and we'll do the best we can to support you if you're out of state. I think this is a great opportunity for us to also share and learn from others around the country as to what they're doing and lend our collective resources and knowledge to one another.
Mary Denise, you should be able to speak now. I see you're unmuted.
Hi, how's everybody? I'm in Somerset County in a small school, and You know, the information is changing every day as to what we're supposed to do. The latest is, of course, we're still holding as many annual reviews as we can on Google Hangouts. We're going to be moving to GoToMeeting soon. We're hoping we shouldn't really be getting any initial evals from INRS. I mean, we can't stop a parent from sending one in. I do have several initial requests from early intervention. Our early interventionists are still going out. So what I'm being told to do is to hold the initial meeting, kind of try to decide if we need to do an evaluation, send the paperwork home. The only evaluation that will be conducted during this time is a social history on the phone. Other than that, we're not hoping to get any other initial evals. And then everything else is sort of on hold, like reevaluations. Like I think somebody else said, you know, if we started it, well, we can't finish it right now, so it's on hold. And basically, as we all know, is just document everything that you're doing. So if there's ever a question later, we have that down. That was it.
Great, thank you so much. That's a lot of good information, and you've started another sidebar conversation as well. So people obviously have more questions about some of these things. Just to keep us moving along, it feels almost impossible that we're about halfway through today's webinar. A lot of conversation, which is great. I wanted to just turn to another question. How are children who are behind academically due to missing school previously, either for illness or partial care, homebound instruction, being supported during this time? Marissa, has multiple youth who are not being provided options rather than jumping in where the other students are and struggling to keep up academically. So I'm curious if anyone else has thoughts on this, how districts are handling it. I know anecdotally, I've also heard from students and parents in other parts of the country that their children may have just moved between districts as well and are struggling to make that transition over to a new school social worker and also new teachers and academics in the whole midst of this COVID crisis. And I can only imagine how difficult that is. So I'd be curious to know if there's anyone who has thoughts or resources on any of those questions. You could raise your hand and Annie will come on and unmute you.
All right, I see somebody has their hand raised. I'm bringing you on. You should be able to unmute yourself. I think that is the name Magui Morales. Am I saying that right? You should be able to unmute yourself.
Hello.
Hi.
Hi. It's Maggie.
Maggie, I'm so sorry.
It's okay.
All right, we can hear you. Do you have any thoughts on that, or how are you handling that?
Yeah, I'm sorry. I had to deal with a situation with work and I just got in. I'm sorry.
That's right, we can come back in just a couple of minutes. Is there anyone else, Annie, who has their hand raised about helping students who may have been behind academically in the past and are really struggling?
Yeah, Jacqueline, if you want to unmute yourself. Oh, you should be able to talk now.
Hi again. So at my school, we're a pretty small district, but we've been really lucky. We work with a behavioral firm. They're called Brett DeNovi, and they also have licensed teachers. So we've just been contracting out some extra teachers to tutor some of our students virtually that we feel really need the extra help. Also, we're utilizing our one-on-one aides that are not one-on-one technically anymore. We're giving them some extra work to do with other students virtually. So they've been really great about just jumping on, doing the work with them one-on-one, and then we're really using Brett Denovi and Associates for that tutoring time because we feel like it's really helpful.
Great. Was there anyone else, Annie, with information to share about that? If not, I have another question that's come through regarding IEPs. I think it might be an interesting, we've seen a couple of those come through.
Yeah, I see Wileen. I'm gonna bring you up. You should be able to unmute yourself now.
Hi, can you hear me?
Yes.
Okay, great. Good afternoon. My name's Wileen. I'm in the Newark Public School District, and we do have a situation where we have a young man who's been out on home instructing for an extended period of time, and our administration is currently working with the home instruction department to see if we can make arrangements for the home instructor to provide virtual services to the family, because what had happened is he defaulted to being expected to be able to do the same work from his roster of teachers, who he obviously doesn't know because he hasn't been in school this year. And we've also been working with our administration to try to use the aides as well to provide that virtual support. We're trying to be creative in some cases, but it seems we're getting approval on a case-by-case basis, so I can't speak to it as a policy per se, but we advocate and get clearance on a case-by-case basis in that way.
Great. And we do hear a lot that this is sort of an evolving situation and there's no policy, universal guidance being given, but this case-by-case is certainly where we're at. And as things continue to change every day, it seems, might just be the reality of the situation that we're in right now. We have another question that came through. Diana works in special education. All of her students have IEPs, and she has a mix of verbal and nonverbal students between the age of 5 and 21. Anyone have tips on how to assist families with students' behavior at home in that transition? She's been creating visuals and sharing those with families, but I'm sure there's a lot of great resources and minds who have also thought this through, and we'd love to hear what you're doing.
I see somebody has their hand raised, just says EJR, or Elise, I think. I'm gonna bring you on. You should be able to unmute yourself.
Hi.
Hi.
Can you hear me? Hi.
Yes.
I just wanted to offer a resource in terms of any behavioral issues in the home. That Perform Care is 24/7 services that are able to have mobile response, link with the family, and depending on each county in the state, provide resources that would, at this time, provide telehealth resources through clinicians to the families. I can put the number is 877-652-7624. Just a really good resource at this time to be able to still provide services as needed.
Great, thank you. More resources, the better right now to help everyone respond and make sure that we're doing as much as we can. We appreciate that, Megan. Anyone else have thoughts on IEP, and particularly with nonverbal students, perhaps, and behaviors at home?
Yeah, I see Matthew has his hand raised. I'm gonna bring him up. Matthew, you should be able to unmute now. You're still muted if you'd like to talk.
Hey, I know that the Autism Foundation Partnership is offering a free 40-hour RBT course. So that's a lot of the skills that the teachers use in the classroom. That'll be a good resource for the parents. If they have time, I might actually doing it myself and get a certificate at the end. And it's a lot of the stuff, the behavioral training that we learn to support those kids in that classroom.
Thank you, Matthew. That's a great additional training. I'm interested in checking that out as well.
And it's funny, we paid for it. We paid for this RBT training like 2 months ago at a different place, and now it's free. So I'm just like, well, now we're just sending it to everybody.
Can you repeat the name of the course? I see a few questions.
I can put it in it's RBT, Registered Behavioral Technician. So it's like it's a basic foundation to ABA analytics. So I know social workers, we kind of figure behavior out through just experience, but this is like the crash course in everything that we already do. We just don't know what the name of it or the techniques are. I can put it in the chat box for everybody.
Perfect. Thank you so much.
Thanks, Matthew. Anyone else with thoughts or want to respond to that? If not, I can move on to a couple of other questions we have.
Yeah, I think we can probably move on.
Fantastic. I know this is a question that we've heard a lot in at least my own school district, from our school social workers. Anyone have students experiencing difficulty with their schoolwork because the parents' lack of English as a first language? And how are you navigating that? How are you working with the families to support the students? If you have thoughts on that or resources, we'd love to hear from you. If you could raise your hand, Annie will open your lineup.
Berta, I'm going to bring you on. You should. I see you're unmuted. We should be able to hear you. Oh, we can see you too.
Okay, you can see. So we do have public schools where we have a lot of bilingual students. We do have a lot of Spanish-speaking people that can help and assist, but one of the tools we use is Class Dojo, because in it there is a translation changed to Spanish. So the teacher can send them a message and then they can change the language in Class Dojo. So that's just a tip.
That's a really great tool. Thank you, Berta, for sharing that. It's one also that my own district is using, and we find it to be a really great way for us to communicate just from a parent's perspective as well. So certainly, if we can put the link to that website if your district's not already using it, and we can put that in the chat box as well. Anyone else with their hand raised, Annie?
Yeah, I see Lenora has her hand raised. I'm going to bring you on. Lenora, you should be able to unmute yourself now.
Can you hear me now?
Yes.
Okay. I'm a social worker, but also I'm in the role now as a student coordinator of student and family services in the Princeton School District. I did work with the child study team for many years, up to about 23. But my role now is more supporting students and families. So what I know, part of what, I'm not sure what all the teachers are using, but I do know that we've worked very hard trying to make sure that our ESL students, some of our students who speak various language, we have different staff who speak particularly with our Spanish-speaking population who are reaching out to them. I've been working a lot to make sure students had computers. So we have our advocates in the community as well as in the school who are reaching out by phone, by computer. Some are actually in the community who are reaching out to families to see what help they need to make the translation and get them the services that they need. And I know the teachers are also reaching out to the counselors, child study team members, and all working very closely together with different tools that the teachers are using to engage the students and support them.
Thank you, Lenora. I want to continue to move on. We do have still over 2 dozen questions in the chat box, so I'm going to keep the conversation moving. Brittany has a question for the group about how the school districts are handling IEP and 504s. That grades have dropped dramatically due to remote learning. a lot of our students are explaining they cannot learn virtually and are failing. How are districts handling that, and how are you working with IEP and 504s? If you could raise your hand and share, that would be fantastic.
So I see somebody has their hand raised. It just says M. Leach. I'm not sure what your name is, but I will bring you on. You should be able to unmute yourself now.
Yes, I work in Camden City School District. So one of the things that we're doing, our teachers was told that based on the circumstances that we're in now, they are not allowed to the students unless they're able to show that they actually modified their work, which we all know at this time that's kind of difficult. So the kids should not fail this marking period from the time school was closed up until now. So really the grades that they're looking to count is any grades that happened before the district closed.
Just as a follow-up to that, I'm curious if there's been any thought given to the 12th grade students who might need updated testing prior to graduation. Any thoughts on that? Are people having forward-thinking conversations? I feel like this might not end until the school year is done.
Well, one of the things, the other thing I know that my supervisor did tell us that she was going to be reaching out to the lawyer to see for those students who are graduating if they can come back in the summer to do testing. Because as we discussed earlier, that was the big question. Should we move forward with testing? And they told us that we have to do still hold the reevaluation planning meetings, but obviously no testing could be done until we come back to school. Only the social workers were allowed to do the evaluations because we can do that via telephone.
Great, thank you. Annie, is there anyone else who had their hand raised to sort of share on this topic? If not, we've got a question from Joshua, who I think is also a little bit of a different direction, but I think a really important conversation for us to maybe have.
Yeah, in the interest of time, I think we can move forward since it is 3:18.
Yeah, an hour flies by, everyone.
Yeah.
So Joshua asks the group, how can we hold conversations with youth and families who recognize the economic and racial lines formed when looking at the rates of infection? His families work and live in the Bronx and Harlem, still required to leave home every day for hourly jobs, maybe considered essential workers. Very good question, Josh. And I'd love to hear anyone's feedback on how you're, working with the families and the children on these issues.
If anyone wants to raise their hand, I'll bring you on.
I feel like that's the $1 million question. There's not a lot of firm answers in this. Well, if you do have answers or thoughts on it, or just generally share the same concern, type it in our chat on the side and we'll still, we can come back to it. I think certainly a challenging question, Josh.
I see he has his hand raised, so maybe he wants to speak on it a bit.
Yeah, absolutely.
Joshua, bringing you up. You should be able to unmute yourself now.
Hey, can everyone hear?
Yes.
So my question is really trying to figure out, like, how are we having these conversations? Are we even having these conversations with youth and families? Because a lot of the families that I work with, some of them have brought it up, but not all of them have. And it's a very real part of this epidemic, this pandemic. I think really what I'm trying to gauge is how many people are actually having these conversations, and what does it look like? What does it feel like when we are having these? Because there are things that need to be happening as well.
Thank you, Joshua. Anyone? There's a couple people that were looking for some clarification. Is there anyone who would like to chime in?
I see Malia has her hand raised. I'm going to bring you on. You should be able to unmute yourself now.
Hi, can you hear me?
Yes.
Hi. So, I mean, I think it's definitely like a really interesting place that we're at, obviously. And I think it's a really good opportunity to talk to families about empowerment and just kind of like, I think this pause like kind of forces us to look at the situation a little bit differently. And obviously, like, we're school social workers. I specifically am a mental health counselor at a high school. And I feel like the priority now is like mental health preservation and not necessarily like how much work are you getting done and to what quality, but like how are you like taking care of yourself, and how are families taking care of each other, and kind of like supporting in that way. So I feel like, you know, when I'm having conversations with students, like we're doing Zoom or, you know, chatting, is like, you know, including the parents. I know like before we were talking about confidentiality and it's kind of hard to do that, but I think again, it opens up an opportunity to like bring mom or dad or, you know, a caregiver into that conversation. And maybe, you know, maybe we're not talking about like the emotional mental health or self-harm or things going on like that, but just like, how are you guys doing? And, you know, using that as like a platform to kind of build empathy on the child's part, as well as, you know, a parent or caregiver. And again, another really cool opportunity to kind of witness the family dynamics and how does this family like handle stress and handle kind of upheaval. And then how do you see yourself supporting in that way?
Great, thank you. I'm gonna let one more person, maybe Annie, before we move the conversation along in the interest of time. Is there anyone else, maybe one more that we could open up the line for? Hand raised.
I just wanted to add one thing before we moved on. I think it's also worth asking our youth and families how those conversations are happening within their own household. I mean, we have this really unique situation where the widespread message is that we should be home and socially distancing and keeping these distance. And so for families who don't have any choice but to continue to go out and to work, how are the children understanding their parents going out, continuing to leave and coming home? How are they understanding that they're not with their friends and their families, but mom and dad still have to leave, and they're still at risk? So I think one way to initiate those conversations is just to ask how it's going at home and how the students are understanding it or processing it, and then just being a support to however it's moving, whatever direction that's moving.
Yeah, thank you, Alexis. So we are, as crazy as that seems, just sort of nearing out the last 8 or 9 minutes of the conversation. And I know there are so many questions we didn't get to and conversations to be had. I feel like this is just the very, very tip of the iceberg in a world of school social work that has just changed entirely in the last 3 weeks and is only going to continue to get more challenging and difficult as we continue to homeschool and as we approach end of year celebrations and graduations and evaluations and all of those things. What I wanted to do is just take a little bit of a pulse of the community. We have, you know, over 500 people on the line today, and we had, you know, over 1,000 people register. There's a lot of conversation around continuing to have a space where we can have ongoing conversations and connect with one another. And I'd love to hear your feedback as to whether you think this, hosted by NASW New Jersey and our shared interest group, would be a good place to do and what that would look like. So if you have thoughts on that, if you could raise your hand and we'll get some feedback from you. The other thing that I would love some feedback from the community on is just in terms of continuing education for school social workers. What are you looking for? What topics are most important right now? As most of you know, we do have an annual conference that's coming up, but we continue to create online learning opportunities outside of our conference via webinars and learning sessions like this. And I would love to hear from the group, what are some of the most challenging issues or pressing ones that we should start addressing for ongoing continuing education credit, specifically for school social workers. So if you could raise your hand, I'd love to hear from you as well.
Lisa, I see you have your hand raised. I'm going to bring you on. You should be able to unmute now.
Hi, everybody. Can you hear me?
Yes.
Great. Thank you. I just want to say thank you so much for this opportunity. This has been phenomenal for me. I work in a small district, and I'm the only full-time school social worker. So just listening to my colleagues in different places has been, just for me, an enormous support. I hope we can continue doing this on like a regular basis. I think some topics that I liked all of these particular topics. I think in the past when I've looked into like New Jersey School Social Workers Association, or maybe some types of like continuing education credits and classes, I find they tend to be heavily geared towards clinical work. And I'm an LSW, so while I do supportive school-based counseling, I don't do clinical work. So a lot more of this type of conversation this has been helpful for me. IEPs, how do we support students and families? Something else I'd wanted to talk about before another time would be, how do we support staff who we know are sandwiched right now? They're trying to instruct their own children from home, trying to instruct their students from home, and trying to do all of this in a very new way. So maybe in the future we could talk about how we help support our staff.
I think that's a great thing, Lisa. I can't even imagine how we're supporting our teams, school social workers, and social workers are always focused on how do we support the communities, but often we forget to support one another. So absolutely a point for conversation. Anyone else would like to weigh in?
Yeah, Carrie, I see you have your hand raised. I'm going to bring you on. You should be able to unmute.
Unmute now. Thank you. Thank you so much for having this. I was thinking exactly what the other woman was speaking about, sort of the connection and the resource sharing and different ideas of how to, I guess, help parents. A lot of the parents that I'm kind of dealing with at this point are sort of struggling with, either financial issues, there's emotional issues, there's losses going on in the family where they're not able to be present for their relatives and grieve and even have family come and support them. So we've had a couple of parents where they've lost like grandparents and the children are struggling and the families are struggling with that. And we're providing, like we're calling and they appreciate that, but I guess resources on that. And then like the ability to kind of come together as a community to support one another is really helpful, just to hear people's ideas and how they're kind of dealing with this, because it's all new to me. So, I'm just trying to do the best job I can. I think that we're feeling like a lot of stress and pressure, and I think some of our own self-care, in addition to the teachers, we're all kind of struggling, I think.
Yeah. Well, you guys are doing, just from a parent's perspective, a phenomenal job. I probably 15 times a day say, I don't know how school social workers and teachers do this all day long. And I never been more grateful for all that you do. And you're all doing a phenomenal job. I know this looks and feels so much different than the world it did a month ago for school social workers. And as much as we can do to provide you resources and opportunities for education and dialogue and just venting amongst your colleagues, I think that's what we really want to do. A couple of things I wanted to make sure that I brought up before we close the conversation. One, it sounds like there's a ton of interest in us creating this space and continuing to host something like this. So we will do so, and we will figure out what that looks like. So for those of you who aren't following NASW New Jersey on social media, if you could do that, like our website. If you're a member of NASW New Jersey, of course you're going to get the information. But I know there are a lot of people who aren't members, and I would just encourage you to make sure that you're signed up on our listservs, that if you're not a member, you're following us on social media so you get the information. Secondly, we do have a webinar in June. I know that feels like a million years off right now, but it is effective strategies for social workers to talk to school staff about trauma. But in the short term, we'll continue to put some of these other suggestions on our radar. And then lastly, self-care is so important. And I am terrible at practicing it myself, but we're working really hard to do it. And I just invite you all to join one of our free self-care events hosted by NASW and Mimosas and Masterpieces. Next week, it's a virtual paint and sip. So it's a free event. You can go on the NASW website. It's in the evening. It is surprisingly a lot of fun to do virtually. And you jump online next Thursday evening, I think, and we all have our own paint supplies and try to get crafty with one another, and we can see and talk to people. And it's just been a really nice way to connect and sort of unwind from the hectic day. And yes, it is online again. And I know we've all been sitting behind computers all day, every day now. So it might feel like the last thing you want to do. But the invitation is open to everyone who wants to join throughout the country. And I hope that you will take us up on that offer. You can register at naswnewjersey.org under events. Alexis, I really want to thank you for joining us and continuing to be a pulse for us on just school social work in general and getting feedback from your colleagues while you're out on maternity leave. I know it's got to feel very strange to be a social worker in schools in the midst of a crisis and be out as well. And I just want to acknowledge how difficult that must be for you.
Thank you for saying that, because it feels really good to participate even in this way, since I'm not there every day, like supporting or helping. So this was a very good way to do it. So thank you for having me.
Well, thank you. So thank you, everyone. We are going to end right on time because we know you all have other things to do. Continue to be on the lookout. We'll offer more information and resources. And thank you all for joining us. Have a good day, and everyone stay healthy. Social distance.